Hi there, my name is Mike Davis and I'm a chartered physiotherapist specialising in musculoskeletal symptoms in occupational health. The session today in the video will look at exercises for arthritic changes in knees. Okay, so the main thing is that from this video is that you've come online and you've said, right, I've got a bit of a problem with my knees. Now, osteoarthritis is a secondary type condition with bones. What can happen is over time that your cartilage will wear away. Okay, now again, this can be through various things. Like before, it can be an age-related thing, it can be a lifestyle choices and lifestyle factors, whether you've had an injury before, whether you've had surgery before. There are quite a lot of factors that actually sort of can cause this problem, and it can be at different stages as well. It can be at quite a mild stage, it could be moderate, or it could be quite severe. All right, now, so if you are going through that process and this is the start of you with knee problems, then these are probably the basic exercise I would advise you to start off at least trying for the next maybe 3 to 4 weeks. If you can try to do maybe 3 to 4 times a week, try and find a time that is good for you, whether it's in the morning, whether it's in the afternoon, whether it's in the evening. All right, so the main thing for that, the repetitions I'd probably say is look at maybe doing 10 to 30 or somewhere in between. But obviously if it's something that you've just started doing and you've still started getting some general aches and pains in your knees, then it's not a bad way to start. Just doing some general types of stretching and then some strengthening, and then making sure that the range of movement stays the same. All right. At the end of these 3 to 4 weeks that once you started, if these symptoms still carry on and you're still worried and you're still getting the same symptoms, my advice to you would probably go to seek maybe further medical investigation. So that can either be an appointment with your local GP, or even if you can get a referral to an NHS physiotherapist or private, that'll be totally up to you. So you can get a full assessment, but generally sort of if you're getting aches and pains, it could be just the fact that it could be an onset of this type of condition. All right, and because it obviously is a weight-bearing joint, your knee, and again, the one thing that you need to do is try to strengthen the knee muscles up and all the soft tissue around that. If you don't like types of exercises, which are these ones, which are the general ones, things like swimming, walking, even cycling, which are load-bearing exercises or activities, would be maybe quite good. So, whether you don't like doing that, or whether you like doing something more where, you're on a bike and you're outside or you're swimming, then again, that can help as well. All right, so they're the type of things to look at when we're moving forward, with your exercise and progression. Okay, so these are again very general, very sort of basic ones. So these are the ones I would again advise to start off with. All right, so initially what we're looking at is if we want to sit down. All right, so again, this can be generally on a chair. Obviously I'm using my treatment bed. All right, and all you've got to do really sort of is get the bad knee or the affected knee, and again, you're just taking it up gently, bringing it back down again, taking your knee back up and then taking it down. So you're trying to strengthen the knee and straighten it by just pushing out. You'll be able to feel your quadriceps, which is the top part of your thigh, and obviously when you're pulling your leg back onto the bend it, the hamstrings are working a little bit more. Okay, so these are the type of things that you can generally do, at the side of your bed, on a chair at home, or even in the office at work. Okay, so there's little things that you can try to help yourself. Okay, now from that situation there, if you can do 10 to 30, then that'd be great. You can do them on the other side even if you're not getting any symptoms. Okay, the next exercise that potentially you can do is if we lie down this time. So again, you can do this on the floor, or you can do it on a bed, but again, generally better on the floor. And all you're trying to do is contract your thigh muscles. Just take your leg off gently off the actual floor of the bed, and then try and hold it there. Try and point your toes towards your nose and hold it there. Okay. Try not to go any further than that, because again, potentially, the muscles start to kick in then. All right. So what we need to just do is hold it there for again 10 to 30 seconds. And again, relax your leg down. Don't drop it, but try to control and make the movement more fluid. Okay. The next exercise then sort of you'll be looking at is trying to sort of take the weight off it a little bit. So we're trying to just bring your knee towards, again, your chest, putting your heel towards your bum, and then going all the way out again. All right. So again, nice and fluid, nice and smooth, and nice and gentle. All right. Just again, try to think about the movement and then the breathing when you're doing that type of scenario as well. Okay. All right, now when we're in this position as well, okay, if we get back up, I'm going to take a foam roller. All right, again, you can use anything from a roll-up towel or anything like that at all. What you can do then sort of is pop that just underneath your heel, okay, at the end, okay. And then all you're trying to do again is bring your toes towards you, push down, so you're extending and you're making your legs straight. And again, try to hold it there, all right, okay, and again, just relax. So again, press down, making sure that you're holding it for 10 to 20 seconds, 30 seconds at most, and then relax, okay. Same like I said we've done before. If you want to change over and do it on the other side, then again, that's fine again, okay. So then just one more. And there you go. If you do feel any pain at any time, then again, please relax, take it easy, take some deep breaths, and then obviously sort of just maybe start it again, all right? Now, other things you can do from that position, if you're struggling there, obviously I'm quite lucky because I've got a bed here that can tip up, okay? If you're sitting on the floor and this is your sofa, then again, potentially if you're sitting on the floor, you can sit what's called in long sitting, all right? So then all you can do is from that position there, bring your knee up. All right, okay, and again, all we're trying to do is slide your leg out, pull your leg up. So slide your leg out so it's nice and straight, bend it up as far as you can, all right, and then take it down again. All right, and again, we're working these muscles in your leg just to make sure that you're doing the exercise, but again, you're taking the weight off, okay? So again, 10 to 30 if possible, and again, nice range and nice and smooth, okay? From that position there, then we'll look at maybe doing a little bit more of strength work. So you can use things like your stairs in the house or steps outside the house. But again, this type of thing are just step ups, all right? So you've probably done this before. If you live in obviously in a house, you've got steps anyway or stairs. You know, if you live in a bungalow, then potentially, you know, you can use other things around the house if there's a step outside. So all I'd like you to do is again, just using your step up. So try to actually step up with your bad knee and just taking it up and popping it back on, all right? Once you get into that position there, again, take it nice and easy, take it steady. Really press up so you're getting the movement and it's fluid. Okay, so quite simple, all right? Once you get a little bit better, then obviously you can increase that movement and you can increase the speed, okay? Just to see how that goes. So again, we're looking at strengthening it up with a bit of weight bearing. The other thing then that you can do is that you can do, again, mini squats, all right? I usually tell people to do this maybe when you're cooking and when you're doing the dishes, brushing your teeth even, okay? But again, the mini dips, basically, we're looking at sort of trying to keep your knees in line with your hips, your toes pointed forwards, and again, we're just going down and then back up again, all right? You put your hands down by your side. If you feel a little bit unsteady, then again, obviously I'm quite lucky, I've got a shelf here, or a sort of windowsill. So again, if you need to, then again, you can press down, you can come up again. Again, try not to flick your legs too far back, but again, you can repeat it. So we're doing that. So if you want to control it, or we can stop and hold. That's the other scenario that you can do. That once that starts to work, you'll be able to feel that. But again, you're working the muscles in that lower part of your body. So your thighs are working, front and back, your calves are working. And again, they're all interconnected around. You need to make your knee a little bit stronger and a little bit more stable when you're doing those type of exercises. The other thing then you can look at is using your own knee and your own legs as a bit of a resistance. All right, so if I just take this down a little bit from there, okay, we're looking at trying again to increase your strength, so resistance. So if you haven't got any weights or any ankle weights or anything like that potentially, then obviously if my bad leg or my affected leg is my left leg, then I can put my right leg over, and obviously then I'm trying to extend the leg up, all right? So again, as you come down, you can change over, put your leg down and force it down. Again, nice and steady, nice and gentle. Keep the movement nice and smooth. Swap over your leg and then go back up again. So you're trying to put a bit of resistance to what you're doing with the movement, okay? But again, like we said before, this is obviously a low load bearing exercise. So you're not putting any weight to the joint apart from your resistance, okay? And again, do 10 to 30 of these, repeating them 3 to 4 times a week initially. Okay, so the last one we're looking at, again, is squatting, all right? But from this point of view, again, I'm quite lucky with my bed, but what we're trying to do is get your bum down. So again, we're using the actual muscles together, so then we're standing up, okay? Try not to help yourself up with your hands. Obviously, if you need to, then again, use that. Usually, chairs in the house are great, all right? They're at a nice height. If you're struggling at that type of height, then do it off the side of your bed. All right, which may be a little bit higher, or the arms of your sofas. Your sofas are usually quite low, So again, progress on to that type of exercise. But again, you're working your legs, you're working your hamstrings, you're working the quads at the front and the calves at the bottom. All right, and again, just nice and gentle. Keep the fluid movement going, because the actual movement, like we said right at the beginning, the actual movement causes the heat in your joints. And the joints like that, okay, and then the actual sort of fluid within that, synovial fluid, that actually heats up as well. So it's a little bit like a car engine, that when it's got a bit of oil in it and the oil warms up, the engine actually works more efficiently. So this is what we're trying to do with your knee joints at the minute. Okay, so that's all of the first initial basic types of exercise that I would advise. All right, so try them, see how you go. If you do feel any pain, like we said, after 3 or 4 weeks, and again, maybe seek further medical interventions or investigations, okay? But generally, osteoarthritis of the knees can be maintained, okay? It can sort of be put into a self-management program as well, and then you can actually sort of manage it yourself. You know, sometimes you can do this yourself, there's no problem with that, okay? Thanks for watching. There'll be more sort of videos on knees if you're on the watch out, and take care, and we'll see you soon. Bye now.